Hello, and welcome to today's Oncology Data Advisor interview. I'm Kira Smith, and today my guest is Armaan Jamal, who is a PhD student in epidemiology at the University of Chicago. And at the ASCO Quality Care Symposium held this year on October 10th and 11th, he is presenting a study titled Factors Associated with Fear of Cancer Recurrence in a Multi-Ethnic Cohort of Patients with Breast Cancer. And today he's here to share with us some more about this work. Armaan, it's great to have you on the show today.
Yeah, thank you so much for having me. It's a pleasure.
Absolutely. So to start off, would you like to introduce yourself and share a little bit about your work and your research?
Absolutely. So my name is Armaan Jamal, and I'm a second year epidemiology PhD student in the Department of Public Health Sciences at the University of Chicago. My mentor is Dr. Dejang Huo. My research interests focus on breast cancer survivorship, pharmacoepidemiology and breast cancer treatment, as well as biomarker development for breast cancer prognosis. But broadly, our group studies breast cancer survivorship and aging.
Great. Excited to hear some more about your work today. So before we dive into the presentation, I'd like to give us some background about what the fear of cancer recurrence experienced by patients with breast cancer involves and ways in which this affects them.
Absolutely. So fear of cancer recurrence, or FCR, is one of the most common and distressing concerns among breast cancer survivors. It refers to the ongoing worry that cancer might come back or spread. Some level of fear is completely normal and it can be helpful, actually. It encourages patients to stay engaged in their follow-up care and maintain healthy behaviors. However, when the fear becomes excessive and persistent, it can be debilitating. And what we call clinically significant FCR can interfere with daily life, leading to many problems like anxiety, depression, sleep issues, and reduced quality of life. It can also result in many maladaptive coping behaviors, such as avoiding medical appointments, or, on the other hand, seeking excessive reassurance from doctors. Now, studies show that roughly about a quarter of breast cancer survivors experience moderate levels of fear, and up to 1 in 5 experience high levels that truly disrupt their lives. Um, in terms of risk factors for breast cancer, those usually for FCR and breast cancer, those usually include longer age, persistent symptoms like fear or fatigue, as well as some other therapies like chemotherapy. But less is currently known exactly what those risk factors are in breast cancer. So that is why we ended up doing our study.
Great. No, thanks for explaining. That's obviously something that really affects people and important to investigate. So what were you aiming to look at and investigate in this study?
Yeah, so we wanted to better understand which patients are most at risk for experiencing high levels of fear of recurrence. And so, in particular, we focused on identifying both clinical factors like age, cancer stage, recurrence, tumor characteristics, and the presence of other malignancies, as well as psychosocial factors like stress and caregiving needs. And by doing so, our goal was to highlight which groups might benefit from targeted support during survivorship care.
Great. Thanks for explaining. And how did you and your team go about designing this study and what did it involve?
So we surveyed participants from the Chicago Multi-Ethnic Epidemiologic Breast Cancer Cohort, which is a large and diverse group of breast cancer patients followed at the University of Chicago. Between July and September 2023, about 1,390 patients with stage 1 to 3 breast cancer completed a validated questionnaire called the Fear of Cancer Recurrence Inventory. And so we combine this information together with clinical, demographic, and psychosocial data from our electronic medical record, as well as other surveys. We asked the survey participants to analyze which factors were linked with clinically significant levels of fear of cancer recurrence. And importantly, it's good to mention that our cohort is a racially diverse and ethnically diverse cohort, allowing us to look beyond patterns often seen in mostly white populations and non-US populations, which is what's primarily been studied in the fear of cancer recurrence space.
Awesome. It's great you're able to look at such a large and diverse cohort. And then what were the results that the study produced?
So we found that nearly 1 in 5 patients reported clinically significant levels of fear of cancer recurrence, and the strongest predictors included younger age, higher stress, having a cancer recurrence in the past or another cancer diagnosis, as well as estrogen receptor positive breast cancer, which carries a risk of later recurrence. We also found that advanced stage at diagnosis was linked with high levels of fear. But interestingly, demographic factors like race, income, and marital status were not significantly related, suggesting that fear of recurrence is likely a universal experience that cuts across various social groups.
Great. And then how can these results that you found help to inform targeted interventions to support survivorship, or how can they just help clinicians to, better care for their patients?
Sure. So our findings really highlight the need for routine screening for fear of cancer recurrence as part of survivorship care, and especially for younger patients as well as those with a recurrent disease or other cancer or higher levels of stress. Now, once identified, patients can be connected to several evidence-based interventions. I think the research has shown that some contemporary cognitive behavioral therapies, such as acceptance and commitment therapy or metacognitive therapy, have shown to be effective, as well as others like mindfulness and supportive therapies. But really, beyond individual therapy, programs that reduce stress and foster resilience, like peer support groups, survivorship mentorship, and educational sessions on actual recurrence risks, can make a real difference. But I guess taken together, clinicians play a big critical role by normalizing these fears, asking them directly, and making timely referrals. And in fact, recent guidelines from the National Comprehensive Cancer Network recommend screening practices at regular intervals for distress, including fear of cancer recurrence.
Great. It's great to know that there are resources set up to help and, intervals that this can be addressed at. Awesome.
Absolutely.
Great. So as I wrap up today, since October is Breast Cancer Awareness Month, are there any messages that you'd like to share to raise awareness of the fear of cancer recurrence and what can be done to help?
Yeah, absolutely. So, while treatment completion is often celebrated at the end of the cancer journey, for many survivors, it's a beginning of a new set of challenges. For instance, fear of cancer recurrence is a very real and common part of survivorship. And for patients, I would say these fears are normal and you're not alone in experiencing them. For clinicians, I would encourage routine conversations about recurrence fear, listening, validating patients' concerns, and connecting them with psychological or social support can make a major difference. And really, taken together, addressing fear of recurrence is not just about reducing worry, it's about improving the quality of life and helping patients thrive after developing cancer.
Wonderful. Thanks so much, Armaan, for coming on today to share these messages with us. It's wonderful to hear about your work and all these interventions that can be done to help this really real problem and help patients to navigate their survivorship journey.
Thank you so much for having me.